My topic is abscesses of the brain, etiology, pathogenesis, clinical picture, diagnosis, and its treatment. So, abscesses of the brain is a pathological process in which a limited focus of purulent inflammation is formed in the cranial cavity. It customary to distinguish between several clinical and pathogenic forms of this disease. Intracerebral abscesses, the focus of purulent inflammation is located exclusively in the brain tissue. Subdural, the purulent focus is located under the dura mater. Epidural, the abscess is located above the dura mater. Here are some pictures of the brain abscesses. So the causes of the brain abscesses is the presence of an infection agent, and sometimes it's a mixed infection, several pathogens. In order for a purulent inflammation to develop, high virulence of the microorganism and a decrease in the protective forces are necessary. Microorganisms, when these two conditions are combined, brain abscess develops. The main types of the microorganisms, the role of which is proven in the origin of our purulent focus, and the skulls are streptococci, bacteroids, protease, staphylococci. So clinics, brain abscesses is manifested by several syndromes which are characterized by certain symptoms, or maybe you can call it signs. So the main signs or symptoms of syndromes of this pathological processes are general toxic effects, fever, chills, weakness, malaise, dry mouth. Focal neurological symptoms leads to appearance of such signs which are determined by localization of the purulent cavity. So there are maybe symptoms that resemble a stroke. For example, if the focus is localized in the right hemisphere, then paralysis or paresis of the left half of the body uh, develops. If the temporal lobe is affected, visual functions may be impaired. Brain-wide syndromes. Several headaches, dizziness, nausea, and vomiting, loss of consciousness, include comatose state, unmotivated change of mood, something decadent, then joyful for no apparent reasons, etc. Diagnostics. General clinical blood tests, signs that confirm this are leukocytosis, an increase in the level of white blood cells, an increase in the ESR, a shift in the leukocyte formula to the left, young forms of white blood cells appear, histological examination of the cerebrospinal fluid. In the cerebrospinal fluid, there will be also an increase in the number of white blood cells as well as increase in the protein content. Microbiological diagnostics. To do this, the spinal fluid is subjected to bacteriological examinations. Diagnosis of the viral infection is carried out using a polymerase chain reaction. Computed tomography. With its help, you can assess the size of the brain lesion as well as determine the severity of the pathological process. Complications. The consequences of the brain abscess for a person can be different. Some patients may not recover from this condition, fatal outcomes. Some people still have residual changes in this form of loss of various body functions that are under the control of affected area of the brain. This means that a person may lose sight, hearing, the ability to think intellectually. He may remain paralyzed in some of the parts of the body, or etc. Treatment. With the brain abscesses, complex therapy is performed which involve the use of the following areas: antibacterial therapy, anti-inflammatory, general tonic, antipyretic, detoxification system, but you should be careful not to develop with brain edema, correction of impaired vital functions, heart activities, respiratory functions, etc., treatment of the primary focus, etc. After some stabilization of the patient's general condition, it is recommended to open the purulent focus and drain it. You can irrigate the purulent cavity with a sterile solution of antibiotic that has a local effect. Long-term treatments at the initial stage, it is performed in the intensive care unit, and the patient is transferred to a neurological department after the discharge from the hospital. A long period of rehabilitation begins. Thank you.